COVID-19 has changed the way we see a lot of things, and today we're learning more about its impact on clinical guidelines for alcohol-associated liver disease. Today we have U of L Health's Dr. Ashwani Singal with us. He was one of the contributing authors on these brand new guidelines, the perfect person to break them down for us. So doctor, first let's start with what exactly is alcohol-associated liver disease?
Yeah, there is a general myth that once there is a liver disease, it's always from alcohol. That is not true. There are many other reasons, and you have to rule those out before you say that this is alcohol-associated liver disease in someone who is exposed to the risk factor, and the biggest risk factor is exposure to alcohol. Typically, and I want to take this opportunity to communicate and convey that it is an amount of alcohol threshold which makes you at risk of getting liver disease. From alcohol, it is 2 or more drinks per day, or 7 per week in a woman, or 3 or more drinks or 14 per week or more in a man puts you at risk of getting liver disease from alcohol.
Okay, and those are good numbers to know about. So let's talk about the new guidelines here. What were some of the findings that really stuck out to you coming out of COVID?
Yeah, we did this guideline section for ACG, American College of Gastroenterology, in 2018, and 6 years later they wanted to bring out new guidelines because few things have changed in the last 6 years in how we handle these patients. There are no medications so far. So what has come up is controlling the risk factor, which is alcohol use, in a more integrated fashion with liver doctors and addiction medicine. So it's taking kind of on the forefront. And two, I think there is an impetus and more, I would say, acceptability of early liver transplant. Early means people who have not yet had 6 months of sobriety. It used to be that unless you have that, but now there is more impetus and there is more acceptability that even patients, select population, not everybody, but select population who have still not yet 6 months of sobriety can be accepted into transplant for end-stage liver disease like cirrhosis or complications.
Well, we know for some people that's got to be really life-changing and exciting news. Thank you so much for your amazing work and for everything you do in our communities. We appreciate it.
Thank you very much.